For the second to the last question, we have to talk about febrile convulsions or febrile seizures. Okay, so they said you should define febrile convulsions. You should list causes of febrile convulsions in an 18-month infant. 18-month infant, the baby is actually 1 year 6 months. Okay, then you should also discuss management of a 2-year-old patient that will present with a 5-hour history of convulsions. So 3 questions under here. Let's quickly move quickly. Now, febrile convulsions in infants, you should know that they are usually triggered by fever, okay, from common infections like viral upper respiratory tract infections, otitis media, pneumonia, gastroenteritis, urinary tract infections. Okay, so let's talk about the causes. Now, febrile convulsions occur between 6 months and 6 years, peaking around 18 months. Yes. So the fever is usually due to infections outside the central nervous system. So just like we listed, viral upper respiratory tract infections like infections from influenza, adenovirus, parainfluenza virus, otitis media infections, that's middle ear infections, pneumonia and bronchitis, gastroenteritis, urinary tract infections, post-immunization fever. Okay, so sometimes after they immunize the child, then you can have the fever there. So what's the management of a 2-year-old that has a 5-hour history of convulsions? So this is not a simple febrile seizure. Okay, so febrile seizures are usually short, less than 15 minutes. So if the seizure is 5 hours, that means it is not a febrile seizure, right? Do you understand? So febrile seizures are usually seizures that are self-limiting. That's on the proper definition. So how to stabilize a child that has a 5-hour history of this? You have to ensure that the airways are patent. Okay, place the child in recovery position. Okay, suction secretions. You have to ensure that the child is breathing. You have to ensure that the circulation is okay. You check for blood glucose levels. Okay, so if there's hypoglycemia, you also note that. So seizure control now. You use benzodiazepam, so drugs like what? Benzodiazepines. So drugs like diazepam, elrazepam, midazolam. Okay, so if the seizure persists, you use drugs like the intravenous phenytoin, phenobarbital, and the levetiracetam. Okay, so these are the different drugs you use. So for the various investigations you do, though it was not asked, you can do full blood count, electrolyte, glucose, calcium test, lumbar puncture to see if meningitis is there, blood cultures to identify the microorganism causing it. Okay, then neuroimaging. Supportive care, you should treat underlying fever and infection, antipyretics, then admit to hospital for close monitoring and further management. Okay, then I think basically that's it around febrile convulsions or seizures.